how competition can hurt partnerships. So I think sometimes with, like, for example, I could have reached out to you and you're like, nah, because you doing something similar to me and you're gonna take my audience. So talk about how that competition can be negative regarding creatives on an online platform.
Definitely. So I'm going to speak from like a place of like transparency and vulnerability. For me, I deal with like comparing myself a lot. And so if I feel like a platform is like oversaturated, or if I feel like somebody's doing the same thing as me, I'm like, oh my gosh, ooh, this really sucks or whatever. But then I had to like kind of step back and realize that just because somebody is doing the same thing within your lane, that doesn't necessarily mean that they're able to speak to the audience that is specifically assigned to you.
That's good.
I firmly believe that there's just so much out there, or so many people who are waiting to hear your specific voice. And I could provide a huge example. I remember when Taraji P. Henson dropped her or announced her foundation for suicidality, or when she was just like doing it in the name of her father. He was a veteran and he struggled with mental illness and whatnot. And I was calling my friends. I'm like, dang it, man, Taraji out here winning. She doing the same thing as me. Okay, she trying to be out here, because she not only caters to like Black youth and mental illness, but she also does like she helps to try to reduce recidivism within Black communities.
Yeah.
And that's a population that I really am interested in, like helping people transition from the jail system or from the prison pipeline system, and getting reacclimated into normal society. Because, well, I don't want to get on my soapbox or whatever, but I really think it's stupid how our government and our country expects people to serve time as they should, and then get out into the real world and they can't get a job, they can't get any housing because they're a felon, things like that. But we're not going to go there. So,
it's the truth, though. Yeah.
But when she announced her foundation, those were like those 3 pillars that she did. I was just like, damn it, man. Like, I'm like, dang. And then you start kind of second guessing yourself. Like, oh man, I wish I had the money. I wish I had the resources. Oh, dang it. Like, it really hurt. And then when Charlamagne and God started talking about mental illness, I'm like, damn it, Charlamagne. Like, I appreciate you for
but why
sharing.
You trying to be great? Yeah.
But why you trying to, like, I'm trying to be great right now. All of y'all talking about mental illness, and this is my platform. This is what I'm trying to do.
And then the kicker was,
girl, and then the kicker was Dr. Jess, girl, because I love Dr. Jess.
Yeah.
And I was like, oh, she's a psychiatrist. She's using Instagram to do basically what I do. But I recognized and I realized that they all have their own specific lane. And excuse me for anybody who isn't Christian, but I firmly believe in God. And I feel like God really does ordain certain tasks to certain individuals. And for anybody who does feel like a platform is too oversaturated or that too many people are doing the same thing, recognize that you have a unique skill. You have a unique way to deliver those skills. And you also have just something that makes you just totally separate from the rest, So don't shy away from the calling that's on your life. Make sure you're moving forward in that, because you can literally save somebody's life by what you do and being your authentic self.
Yes. So, yeah. Yes. It's a whole preach. Y'all can go ahead and donate. What's your Cash App so they can sow?
Girl!
No, it's so true. Y'all, for those who are live with us, can y'all do me a favor? Can y'all hashtag in the comments, #my creativity matters? Let's do that. Let's do that for the culture. My creativity matters.
And so to go back to your question, when you reached out to me, like, look, that's one thing that I already do. For anybody who has seen my YouTube channel or doesn't know much about my channel, I do these things called, what's it called? Counselor chats, where I'm always reaching out to Black clinicians and collaborating with them, because like we said, representation matters. Yes. Not a lot of people know that we really are out here, and I live in Atlanta, so I mean, we really out here. We really out here. And I just really try my very, very best for these amazing clinicians to share their gifts and their talents and what they do, because therapy is such a wide range. There's so many niches. Like the video that you saw with Dr. Christopher Holloway, she
Mm-hmm.
specializes in women's issues. And the crazy thing is the video that we did came out probably like 2 weeks or around the same time that Michelle Obama talked about her issues with infertility. And it was
Mm.
just so timely, so timely. There's another therapist that I worked with, my clinical supervisor. She has experience with like borderline personality disorder, and she is also a owner of a private practice. There are clinicians out there or people who are looking to get into therapy who probably want to own their own private practice. And so it's best for you to be able to learn from these situations or learn from these people's stories for the free, by the way. All I ask is that y'all
Absolutely.
like, comment, subscribe, and share. That's all I ask. But it's best for you to learn through their experiences so that you don't have to make those same mistakes, or so that you can find the correct clinician that will meet your needs as well. So,
Absolutely. And I love that Tierra, who's an LCSW here in Florida, said
hey,
black clinicians
Tara!
black clinicians matter. Yes, they do. I love it. And, just to piggyback, I love this, is because, so personally, my passion is fertility and like women's health and maternal mental health. And my clinical supervisor, who I have right now, is not a creative in any rate. It's agency. He's an agency clinician, which is
Yeah.
cool. It's okay. That's his grace. And also, it's not African American. And I remember when I discussed in supervision one day my goals, my passion, and they were like, it was a group supervision, and everybody, I'm the only African American, I'm the youngest one in there, and
Yeah.
everybody was just like flabbergasted, like, what, you can do fertility work as a clinician, or what, you can use
Mm,
social media, what, you can be creative. And I'm
right.
like, I felt so constricted. And that's actually the night that I Googled, I'm like, YouTube, and I'm like, there has to be someone out here that has spoken on this topic, and your video was the first video that pops
Oh my
up.
gosh, that's
Isn't that crazy?
amazing.
And
Gosh,
so
that's amazing.
imagine if you, oh my God, imagine if you did not have this platform. Imagine if you didn't do your video. I'm now poor little black Tashara in Fort Myers, Florida, would not have known that, the clinician that was on, is it Dr. Holloway?
Yep, Dr. Holloway.
That was on, or that there's other clinicians that are interested in this work, or that have done this work that I can learn from, because my direct supervisor doesn't have that. And so it's just important for
Yeah.
us to be authentic. And yes, your platform reaches people that Taraji won't, that Charlemagne won't, that Dr. Jess won't. And so I just want to encourage you, from clinician to clinician, to just keep the faith and keep moving.
Yes.
Mm-hmm.
Girl, that's a blessing for real, for real. Thank you so much for that.
Absolutely.
Yeah.
Absolutely. Guys, any questions or comments? Very great topic. Thank you. Good. I'm glad that it's helpful. Let me move around a little bit. So let's do some education. So I don't want to assume that everyone on here kind of knows a lot about like psychology or mental health. So I'll do just an educating topic, and then I have a follow-up question for you.
Okay.
So the process of counseling has been accused of being Eurocentric. Historically, counseling theories and techniques were developed by white counselors and therapists of European American descent who worked exclusively with white clients.
Hmm.
Scholars have noted that although many therapeutic techniques have been developed and empirically validated as being effective, guys, that just means it's evidence-based, limited research has been conducted with respect to the effectiveness of such interventions with people of color and clients who are not of European descent. And so the term clinician is interchangeable for therapist or counselor in our field. And personally, throughout my 4 years in the field, I've noticed that a lot of people, when they think of therapy, they think of like Freud. They think of the patient or client on the couch and the psychoanalyst
Yeah.
over them doing like some type of weird stuff, and it's like the shrink, that
Yeah.
dynamic. And for a lot of Black and brown people, that presentation or that process, they're not really vibing with it. And so can you talk about how you utilizing creativity, whether it's in your workplace or through Legacy Speaks, has directly brought in people who look like you?
Yes. Okay. Girls. So I love our people. I really do. But sometimes y'all be giving me hell. because,
One more time for the people in the back.
because like you said, the Freudian theory and laying on the couch and laying on the sofa and whatnot, and then immediately the first thing they say is, I don't want you all up in my head. I don't need you to be messing with my thoughts, or just all of these negative stigmas that we have grown up with.
Yeah.
Like for example, having that family member who there's like, oh, you know, Auntie Kate, she crazy or whatever. But Auntie Kate, yeah, I get she crazy, but like, what's the underlying issue? Like, she probably may be a schizophrenic, she may be bipolar, she may be like severely depressed, or
Trauma.
trauma, yes, trauma, or um, I created my very first video actually was created to dispel myths among people of color. And then, you know, when it comes to depression, it's just like, oh, you lazy, or you need to go do this, or you need to pull yourself up by your bootstraps, or, oh, girl, the classic one, you're not praying hard enough.
Oh,
Okay,
because God
you're
is the
not
only
you're
answer.
not praying hard enough, or you need to get back in the church and do this and that. And we're just so superficial to the point where we're so afraid to talk about those places of vulnerability. That's why we have issues like what's going on in the media with R. Kelly. Things
Yeah.
that we like to sweep underneath the rug, you know, things that we would like to avoid as families or as a people. And it really does suck. So in terms of like the creativity that I use when I'm creating a relationship or starting the therapeutic process with an individual, I use that first session as an opportunity to get to know them better, get to know who they are, what their presenting problem is or their presenting issue is. And then most importantly, I try to take it from a egalitarian approach.
Okay.
I try to be as collaborative as possible. Um, because I know with us or a lot of minority communities, we expect to go to the professional and be like, hey, you're the professional, you're the one with the degree, you tell me what to do and I'll do it, and then all my problems will be solved. And that's not what therapy is about. I mean, there will be some instances where the clinician will take a more directive approach with like psychoeducation or bibliotherapy or providing resources or homework. Yes, y'all, you do get homework in
Yeah,
therapy.
you do.
So it's like, of course, you take a more of a directive approach in that instance, but a lot of clinicians operate from a person-centered approach, or depending on whether or not you're in managed care, cognitive behavioral therapy, because you know with Medicaid and Medicare, you need to have things that are like specific when you're submitting those bills and whatnot.
Yep.
That's a whole different topic, guys. But I just try to be as creative as possible and include things that are very, very pertinent to their life. The basis of therapy is being an active listener. And if a client doesn't feel like you're connecting with them, they're one, not going to come back, or two, just quit on therapy altogether.
Period.
And one thing that I found is we're the type of people where I tried it once, and if it don't work, then to hell with it forever. And it's just like, no,
Yep.
that clinician may not have been right for you. Like, just keep trying and just keep going. So it's a lot of give and take on both sides, from the clinician perspective as well as from the client or the patient's perspective. And it goes back to that conversation that we had earlier of like recognizing that we're all human. And then as a clinician, you have to make sure that you're learning how to adjust accordingly. Because yes, I'm Adlerian at heart, meaning that I care about your social interests. I care about your birth order. I care about how you see yourself with respect to other people and your place in society and whatnot, and challenging all those irrational beliefs. But that may not work for a client that comes in my office. That may not work for a patient that I'm seeing immediately. So I try my very best to gain as much information as possible so I can know how to help you, not only in the moment, but for like the rest of our therapeutic process.
Yeah. Yeah. You have to be self-aware. If something doesn't work, and that's just like any other relationship, if it doesn't work, it doesn't work. And that's where communication comes in. And from an ethical perspective, you know, we're held to that standard, that
Yeah.
if we're not meeting the needs of a patient or client, it's unethical for us to continue seeing. No, you can, you giving us money, but we not helping you. So yeah.
Right. Right. Definitely.